Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Positional plagiocephaly. Introduction. Positional plagiocephaly is also known as flat head syndrome. It affects babies during their first months of life. Flat head syndrome doesn't affect the growth of the baby's brain, and the flattening usually resolves by 2 years of age. However, parents and caregivers can accelerate the process toward a round-shaped head with positioning. This program explains what flat head syndrome is and how it's treated. Background. The baby's skull bones are not fused when the baby is delivered through the birth canal. This allows the baby's large head to adjust in size as it passes through the birth canal. The skull's bones don't completely fuse until the baby is about 2 years old. The 2 soft spots at the top of your baby's head are where the bones haven't fused together yet. They are called fontanelles. The shape of the newborn's head can be uneven after birth. However, it should soon gain its round shape. If the newborn rests its head in the same position all the time, it can result in a flat head over time. This is flat head syndrome, also known as positional plagiocephaly. The other type of plagiocephaly is congenital plagiocephaly. It is a skull defect known as craniosynostosis. In congenital plagiocephaly, the bones of the skull fuse prematurely, affecting the shape of the baby's head. The treatment for this congenital condition is surgery to allow the skull bones to grow naturally before fusing. This program is about positional plagiocephaly. Signs. It is easy for parents to recognize flat head syndrome. The back of the baby's head is flatter on one side, which is easier to notice if you look at your baby's head from above. You may also notice less hair on the flat side. In addition, the ear on the flattened side might look pushed forward. In severe cases, the forehead of the baby might bulge on the side opposite from the flattened side. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Flat head syndrome happens when babies sleep on their backs and keep their heads in the same position. Babies who often turn their heads from side to side as they sleep are less likely to develop flat head syndrome. It takes efforts for babies to turn their heads. Babies with tight neck muscles can't move their heads easily. The tight neck muscle is called torticollis. Premature babies are more likely to have tight neck muscles, therefore more likely to have flat head syndromes. When the tight neck muscle isn't exercised, the neck muscle becomes stiffer. The stiffer muscle results in less turning of the head, therefore more flattening. Treatment. Healthcare providers can diagnose flat head syndrome by looking at the baby's head. They can also diagnose torticollis by watching how the baby moves his or her head and neck. Flat head syndrome often clears on its own as the skull grows and fuses. However, parents and caregivers can stop further flattening and speed up returning to normal shape. Here are 7 tips. 1. Reduce the amount of time your baby lies in swings, car seats, and bouncy chairs. 2. As you put your baby in the crib, change his or her position to encourage turning the head. For instance, place your baby's head near the foot of the crib one day, then the head of the crib the next day to encourage the baby to turn. 3. As you feed your baby, alternate the arm holding them. 4. Pick up and hold your baby more often as he or she lays on their back. 5. While the baby is awake and you are supervising him or her carefully, place the baby on their stomach on a firm surface. This helps the baby lift their head, which moves and strengthens the neck muscles. 6. Change the position of your baby's head while he or she is sleeping on their back. Don't use pillows to keep your baby in one position. 7. Keep placing your baby on his or her back as they sleep to prevent sudden infant death syndrome. You can put your baby on their tummy only when he or she is awake and supervised. Your healthcare provider can show you exercises to strengthen your baby's neck. Most of these physical therapy exercises involve moving the baby's neck to the side opposite of the tilt. In some cases, your healthcare provider can prescribe a helmet that allows the head of your baby to grow only in the flattened side but not in the round side. Discuss this choice with your doctor.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. Babies may develop flat head syndromes if they don't turn their heads often as they sleep. This is often due to a tight neck muscle. As the babies grow and their neck muscles develop, they begin moving their heads, and their flat heads improve on their own. Flat head syndrome doesn't affect brain development. However, if babies cannot turn their heads easily during their early months, they are less likely to learn as fast as those babies who can turn to look and learn from their caregivers and environments. Parents and caregivers can help speed up the resolution of their baby's flat head by learning how to change the baby's position in the crib, helping the baby exercise the neck muscles, holding the baby, and offering more supervised time while the baby lies on the tummy. Thank you for using Explain.